Hello, my name is Sebastian Steger and I'm a researcher with the Medical Imaging Department at Fraunhofer IGD, the world's leading institute for applied visual computing. In this video I will give an overview of the NeoMark image processing tool, give a brief explanation of the image processing and image analysis algorithms, and talk about the key innovations. NeoMark is the first project to integrate and analyze heterogeneous data in order to predict the reoccurrence likelihood of oral cancer patients. Clinical, genomic, and imaging data is collected and stored in the NeoMark database. From there it can be analyzed by sophisticated data analysis algorithms. The output of the project is the prediction result, of course, but also the identification of yet unknown risk factors, as well as statistics that can be used in further clinical studies. This video is about how the imaging data is extracted and uploaded to the NeoMark database so that the data analysis module can process it. Every 6 months, CT and MR images are acquired and imported into the image processing tool. In order to align them, image registration is performed as a first step. Then, tumors and relevant lymph nodes are identified and 3D models of these objects are obtained by segmentation. Based on that, texture and geometrical features are extracted and uploaded to the NeoMark database. All of this is done by an experienced radiologist operating the image processing tool. This is the main view of the NeoMark image processing tool. A patient has been loaded and the images have already been selected. The left side contains an image viewer. The user is able to select the plane he or she wants to see, but may also choose a view that jointly shows the axial, sagittal, and coronal plane along with a 3D view. On the right side, the user can walk through the different CT and MR images. As you can see, the CT and MR images are not properly aligned. In the next step, image registration is deployed, ensuring correct alignment of the head in both imaging modalities. In the image registration dialog, you can see the misaligned images jointly, the CT image in red and an MR image in green. The tool is able to automatically rigidly align the images. This is done by detecting the chin in both images, resulting in an initial alignment. This alignment is then refined by maximizing mutual information, the state-of-the-art technique for multimodal image registration. As you can see, the head is now well aligned and features can be extracted jointly from both modalities. However, due to the different positions of the spine, the alignment in the neck area remains unsatisfactory. To address this issue, we are currently exploring and developing innovative, non-rigid registration methods. First, all bony structures, such as the skull, the jaw, and the single vertebrae, are segmented individually. Those structures are then rigidly aligned to the MR image piece by piece. The transforms for the surrounding soft tissue are then determined by extrapolation. Due to incorporating prior knowledge about human physiology, the capture radius is increased compared to other deformable registration methods. Once all images are aligned, the user has to identify the target structures, tumors, and relevant lymph nodes. For lymph nodes, the boundaries are determined automatically by a single click in the center. Upon confirming the boundaries, a 3D model is created from which geometry as well as texture-based features are extracted. The geometric features include the volume, the axis in three-dimensional space, as well as the shape deviation. For the texture features, the Hounsfield unit variance, the contrast take-up rate, and the amount of necrosis is identified. Further properties, like the invasion of surrounding tissue, has to be entered manually. Let's take a look behind the scenes. For the automated lymph node segmentation, an initial spheric model is placed at the seed point. Then, gradient and intensity forces are applied that push the outside of the model towards strong gradients and the inside towards typical lymph node gray values. Internal forces, such as spring forces and torsion forces, keep the model together, thereby preventing boundary leaking. This process is continued until convergence is reached. From the segmentation, a 3D model is created. Based on that, the minimum volume bounding box is computed, from which the three-dimensional axes are extracted. In contrast to current size assessment standard RACIST, those axes are independent from spatial orientation of the node. These size features, along with all other extracted and entered features, are then automatically uploaded to the central NeoMark database. Thanks for watching. For more information, please visit www.neomark.eu. NeoMark is a European research project co-funded by the European Commission, Sector ICT for Health, Challenge 5, in the context of the 7th Framework Programme, Call 2.